We got 10 o'clock, let's get started. Let's get started.
Let's go.
All right.
Well, first of all, I want to thank Jonathan Thummel for taking my place last Monday morning so that I could attend Steve Brown's funeral. Jonathan's just he's such a great help, and he's just so eager to do things like that. I just really appreciate him. And nowhere in this presentation is the word nerdy to be found. To relax a little bit. And the fact that this is all state grant-funded money is another part. But I welcome the chance to do a little refresher. We have some additional money sources this year that we didn't have before. So it just kind of, I think, kind of gives you an idea of where things come from and where things go and how what the process is of community corrections. It continues to get better, I think, in terms of our methods and our approaches and the way we do things, and I'll highlight a few of those things. But we have a variety of funding sources. So, my salary comes 4 different ways. It's divided up 4 different places contribute to those things. We first have the juvenile budgets. I thought that's probably the lesser complex of the two, and we receive annually a graduated sanctions block grant. Graduated sanctions are those agencies that come in contact with the juvenile short of incarceration and or a juvenile correctional facility, prison. So anything that that happens in the community that helps to supervise or helps to get these kids in the right places, that's graduated sanctions. And there's 3: juvenile intake, JISP, which is us, juvenile intensive supervised probation, and community corrections case management. So there is a block grant that goes to those 3, and we get 2/3 of it. It's basically divided up that way. Juvenile intake gets 1/3, we get the other 2/3. And we don't divide it up quite in half in terms of probation and case management. Case management are the kids that go into state custody for out-of-home placement. And that can be anywhere from a foster home to a group home to a psychiatric residential treatment facility for time of stabilization. So we do kind of run a gamut there. But our officers track how much time they spend doing ISP work and how much time they do working with their custody kids. And that also then involves, under grant funding, the kids that go to a correctional facility, we must see them monthly. And then once they're out, they have a period of like parole, but it's called conditional release or aftercare. And we do the supervision of that. So there's really 4 statuses for juveniles that we cover in our office. So anyway, case management, our officers spend a greater amount of time and resources on that. So those budgets are offset in that way. Case management receives more budget funding than ISP does. Their budget request funding and how that is set up is a little different, not so clear cut as in my eyes. So we did some program budget summaries there at the beginning after the introduction to show personnel and travel subsistence and equipment supplies, contractual, professional. And because then personnel spends more time in case management, then, for example, their budget personnel-wise is $388,000. $673, while on ISP it's $207,585, and that includes administrative as well as personnel. The big jump probably on the case management side is that item E, contractual professional, and that simply is transportation services to move kids in custody to their placements, to their court dates, for home visits as those occur, and those get more frequent as the young person gets ready to transition home. And we use security transport services, and it's very expensive. There's just no, at this point, we found no better way of doing that. So we have a budget of a little over $54,000 just for transportation costs. Now, this year, we were able to reduce that a bit just through our officers kind of coordinating. If various officers had kids at the same placement, we'd often have them come home together for the same weekend and then transition back, and that can be a significant saving to have multiple kids in the car rather than just one at a time. So just by networking amongst our 7 officers, we were able to save some costs, and we're thankful for that, because that can certainly be quite an expense for us. And of course, they share, juvenile shares in the cost of our rent and our supplies, everything that happens at our office. So, are there any questions about the juvenile portion at this
Commissioner?
point?
No.
I do have one,
Certainly.
Mr. O'Hare.
Yes.
Looking at not just the juvenile, but we can touch on this at the end or if necessary when we talk about the whole. Community corrections has not always been where in their current location.
I suppose not, but I think we have been there in excess of 20 years.
Right. Yes.
Okay.
It's been a
Yeah.
length of time, but it
Yeah.
hasn't been there since the dawn of time.
Probably not since the dawn of time.
But
No.
just a question, and I made a note maybe to kind of just
Sure.
to think long range.
Okay.
Shawnee County has been engaged in the process of looking for a facility for our health agency.
Mhm.
When we're talking about the health agency and some of the things that they do, and some of the partnerships they have with Vallejo Family Service and Guidance, should we be talking with you as well to see if we can fold in community corrections with these others?
Well, I think that conversation has come up periodically. We have no allegiance to H.T. Paul and to the 3rd floor of 712 South Kansas Avenue.
Right.
It has been a very strategic, I mean, location-wise, it's been an excellent place to be because of the fact that we are often called to court right now.
Right.
So something that we can, walk across the street or walk a block,
Right.
block and a half, has really been a good thing. If we could be closer, sure.
Right.
If there was, there's been talk of being as close or somewhere near Department of Corrections from time to time. We'd actually prefer to be a little closer, but
Right.
anything that, we spend about $100,000 a year.
If
to
I
be-
look at it,
to be
you
on
have
that floor.
110,000 in building rent,
Yeah.
and then an additional 80,000 with the juvenile JIS. Or am I reading that wrong?
I think that's a little bit.
Or I guess it's 23,000.
Okay.
Sorry.
Rental cost for both juvenile departments, 28,789. I'm gonna say that's probably 25%.
And
of the
I'm
bud-
looking at page
for each.
7, it's labeled page 74.
Okay. On the juvenile side? Pages?
As I
Yep.
work through the packet.
Yep, okay. Okay. Rental costs, 80,000 at the top, that's the 23,000 that juvenile intake spends for their building, and then the 28,789, 25% of our total. So 4 times 29,000 is really what we're paying.
And then an additional 23,000.
Okay, where is,
Or, I mean, because if you have 28,789, that's
Mhm.
times 4.
okay,
And then at a separate location, you have the juvenile intake and assessment.
oh, yeah, oh, I understand, yes, juvenile intake, if all 3 agencies were
Right.
somewhat combinable,
So we're talking about a combined rents of 133,000.
you would be, yeah.
And-
We've never been located with intake, but certainly, you know, their location, I think, can be anywhere in the
And
city.
very candidly, this is very much off the cuff. This is not something that I have thought through or
Sure.
thought out. But it just occurs to me as county commissioners, we're looking at space needs. And if we're looking at acquiring future space, if we have the ability to incorporate in those needs and looking at the partnerships that we've formed as a
Mhm.
county with Family Service and Guidance, with Vallejo, with the health agency, some of their initiatives, I mean, those might be partnerships that could be beneficial long-term.
Yes.
And so if we had space, is that something that we could talk, I mean,
Oh, yes,
and
yes, yes,
does
sir.
And does the county commission have the directive as to where you're placed? I know that your budget's a pass-through budget, but do we have the ability of telling you where your space is going to be? Or do you know?
I don't know, because I don't know how 712 South Kansas was originally chosen as a site, and we did not originally even occupy half that 3rd floor. Now we have the whole 3rd floor.
I mean, obviously, if I said I was gonna put you in the sub-basement, you might have some objections to that.
It's darker, but that space is just, you know, is
But-
really what's important for us.
So, I mean, I guess just looking at if space needs come up, and that might be, again,
Okay.
just as kind of a down-the-road, big-picture thought
Okay.
process. And those
We
might be
could-
rents that we
We can
could-
certainly be a part of any conversation that you would invite us to be a part of, yeah.
And then also if that was to present itself, to be able to cost share with telephone,
Mhm.
information technology equipment. So, all right, anyway, that's all I had.
Commissioner.
Kind of along those lines, I mean, it is, all your expenses are covered by grants.
Yes.
So it would probably need to be explored whether you could transfer, you
Mhm.
know, those grants to, if you were in a standalone facility.
I-
So just, you know.
Yes, I think that's, I think that's, would be if our county provided
Yeah,
our space, would we still be justified to the state
Right.
for paying
Right.
$100,000 plus in
Right.
rent?
right,
Yeah,
Yeah.
which would
yeah.
obviously be going your way, and I think that in previous times, that was one of the things that the
Yeah.
county commissioners really looked
Right,
at,
right.
was not only can we house community corrections, but can we receive the rent
Right,
that they pay right now to H.D. Paul?
yeah, yeah, okay.
And I don't have the answer to that yet.
Okay, all right. That may be something just to look into
Mhm.
down the
Okay.
road. And again, we haven't
Certainly.
acquired any space yet also,
Right.
Yeah.
that I'm
And-
aware of.
And across the state, where
Me either.
agencies, do share courthouse space, they're right across the street, they're in private buildings. You know, there is no uniform way that community corrections is located from district to district.
Okay. That's the questions I had, but.
All right,
Sorry.
other
Okay.
questions for juvenile? All right,
continue
thank
it.
you. Well, the yellow tab, the next section there is second district adult. We not only provide supervision for Shawnee County, but from the very beginning, we have had a unique position in that we have contracted for supervision, adult supervision, in the second judicial district, Jackson, Jefferson, Wabunsee, and Potawatomi counties. That's been an excellent relationship. We have 3 officers that are funded with second district money, and they do an excellent job up there. We hear continually from the judges, just they really love our supervision. They like working with our officers, and they do an excellent job. Now, our officers do have their actual offices over at 712 Kansas, and they do have Shawnee County residents who have run amok in second district. And so they certainly see them, and they have places at each courthouse where they can see their clients from the various county districts. And it's gone well. Now, one of the things that second district has never really been able to do, second district funding has never really been able to provide a standalone budget. And if there's any, this would be the only time that I would be a little critical of Kansas Department of Corrections. It seems like because we house them and they're on with us, second district money seems to be smaller. They could not operate as a district on that money and stand alone somewhere up in Holton or, you know, they just couldn't do it. And we've made mention of that from year to year. But now it is getting a little better. I'm not sure they're really up to snuff. I think they're still a little bit under percentaged in some of our costs. But we received additional money this year, and all the adult things I'm going to talk about us having more money than we even prepared for our FY15 budget that just began in July 1st. Certainly in the third district too, we're going to talk about this additional money. And how this has come about in such lean times is because the legislature has obviously funded Kansas Department of Corrections in an adequate manner. If you remember last year, it was a mess, and the governor vetoed the KDOC budget for FY14, had to be kind of reinstated, and we just operated off this assurances that come January they would restore the funding that they had inadvertently eliminated due to some misunderstandings of House Bill 2170 and some parts of that. Anyway, there is a funding formula for how things, how monies go, how block grants are given, and it's average daily population. And for us, second and third district, that has gone up. We are servicing more clients, supervising more clients than we ever have. The success rate of our clients, that's gone up considerably, and success rate means how have they finished their time of supervision? Have they stayed out of prison, or have they had to been revoked and then sent on? That's an unsuccessful probation. Successful is 12 months, they're still at our office, they're still in the community, or 18 months, 24, whatever it ends up being. have they been successful? They may have some jail sanctions, they may have some time in jail just to kind of get their head together. But throughout the time, they were never revoked and sent back to prison. So our success rate has been over 75%, or right around 75%, and we get credit for that. The other escalating factor is the risk level of our clientele. And that has risen, as well as the number of clients. Now, what I mean by a risk level is a variety of factors, including past criminal history, current charges, and all of our adult clients are convicted felons. If they're a misdemeanor, they are with court services. That's kind of a set thing. We do have felons. But we have, because of plea bargains and departure rates have factored into more people coming over to adult intensive supervised probation instead of going straight to prison. Now, that is just the way it is. That's the way it is in Shawnee County. Now, departure rates are when a judge has a sentencing grid before them and yet departs from that for a lower initial sentence. And that can mean prison is part of the sentence, but it is held in abeyance, it is suspended, and they're put on ISP to begin with. If they finish successfully, then they never go to prison, instead of having initially gone in the first place. Some of the philosophy is that if under intensive supervised probation, if they just obviously are not about business, then they will go to prison, but they had a chance. They had their chance. And there's certainly a cost savings by not having them go to prison initially. And if they're successful on ISP, well, all the better. They probably worked, they paid some taxes, they've remained law-abiding in the community instead of the expense of them being in a prison cell for that period of time. We have, in some candid conversations with judges who are elected don't depart. That's, it doesn't happen. So it is some of the way it is. And when we get somebody who's high criminal history, we know that it's going to be a rough haul. You know, that officer's going to work extra hard on that person to keep the community safe, to keep them successful. But that's what it is here. And our success rate, just as a matter of fact, has risen this past 12 months about 10%. We're operating at close to mid-80s on the adult side of successful completion of probation. Where 75 is the state goal. We are way above. We're in rarefied air, and we are doing this with higher numbers of clients being supervised and higher risk levels of clients. I have to attribute that to our staff. Absolutely. They are amazing at what they're doing right now. Absolutely.
Yeah, whenever you have level trends and comparisons that look so good, you always have to ask why. And it's staff, in your opinion?
It is.
Okay.
It absolutely is. But we have some additional things going on. Well, anyway, all right. I love to talk about community corrections, so sometimes I just, and I kind of have a teacher side of me, so I'm always explaining more than sometimes people want to know. Well, on that summary page at the beginning, the additional money came to $35,521.85. That's not a huge amount, but in second district, it really, really is. And we've been able to put that money for the vast majority of it into programming. And basically cognitive behavioral change thinking treatment. We have 2 licensed clinical social workers that we contract with that provide these groups. They provide them in Shawnee County. They provide them now up in the 2nd District. We have a relationship with the Potawatomi Nation up there where they provide space for us to hold our Thinking for Change classes. We have additional money now for sexual offender treatments and GED testing and so forth. So we're really able to just push that money in. Staff-wise, for 3rd District, we're okay right now. Ratios are good. They have more travel, so their numbers for each officer to client ratio are less than what we have at Shawnee County, but they're very adequate. We have 2 officers that do Jackson Jefferson, single officer that does Wabaunsee and Potawatomi. Numbers are holding, they're pretty steady, a little bit of an increase. And then some of that is one additional caveat to the 2nd District budget, is that KDOC recognizes when officers have travel and we get additional money for that. That's the 4th factor of our funding formula up there. So it's daily population, the risk level of the clients, and our success with them. It contributes to our funding. And we were absolutely surprised to get more money. This is just weeks ago. In fact, we're still just working to budget it in. It hasn't even been submitted with the final budget to KDOC yet. 3rd District is the green tab there, and the papers to follow. And we received $1.252 million. We weren't expecting that much, almost 60,000 additional money. And that's really some welcome money, because statewide they're anticipating about 1,100 new additional clients, not new, additional clients on adult intensive supervised probation. So we see that as a chance, an opportunity, and we'll be visiting with you shortly to add an officer with money for that, and then retain the 2 cars that we had planned to replace with the new cars we recently purchased. But we can kind of keep them around and keep them for in-town use. And if they break, so be it. I mean, they're a 98 and 99 Crown Vic, and they both have about 175,000 miles on it, but they've been well maintained. And so we'll just continue to drive them. So some additional money then for parking and for insurance on those 2 cars. And then additional bus passes. That sounds like that's $7,000 for bus passes. A bus pass, there's bus passes and bus tickets. Boy, we know all about buses. That's how our clients get around. Bus ticket just gives you a ride on the bus. A bus pass gives you a monthly pass. So if we have somebody that's starting out working and they're going to work every day, oh man, they're a bus pass. That's a candidate for a bus pass. If they are just coming, twice a week to our office, well, they're going to get bus tickets. They're going to get a ticket every time they leave. They'll get a ticket for the next time. Or if they're coming in for a job club meeting or a Thinking for Change behavioral cognitive health program, we'll do that. But we often run very tight on that. We can't let transportation become an obstacle to them showing up for treatment, to them showing up for office visits, have them showing up for job interviews. That's a barrier that we really want to not have in the way. They have enough problems, often seriously of their own. So if we can provide transportation for them so they can get where they're supposed to be and be accountable for that, then it works out very, very, very well. So that's what we're looking at with that additional $59,000. and we're very happy to be receiving it. Really is a good deal. Any questions about adult?
Commissioners?
Second or third?
Yes, not it.
Okay. Well, and this is really nice. This is money that we didn't have 12 months ago. We heard that it would be coming through the Justice Reinvestment Initiative. And this came to us about 6 months ago first. And it's called Behavioral Health Intervention Grant Money. For the remainder of our FY14, it was $2 million statewide. This year, it's this new fiscal year beginning July 1st, it's $3 million. And we have received a portion of that. And it's a very different process in terms of how we go about receiving that funding. And here's kind of what it does. It's based upon the premise, of course, still of keeping people who are our clients from going off to prison. It's helping them receive the services in the community that are available, that they need, but in a way that helps our officers. Our officers just don't have time to make sure they make every appointment, that they get to Vallejo for mental health, or that they have money, did you save money from your paycheck for your psychotropic meds? Those things don't always happen, and it would be great if they did, but they don't always. So this year, we have received $128,120 under this grant. And that's significant. That's a lot of money for us. That's a real good thing. I sometimes pinch myself when I think about this. And how this works is we're able to fund some people to work for us and work with us. Now, it's all contracted. It's KDOC money, and it's contracted with Heartland Radar, which is the Regional Alcohol and Drug Assessment Center. They provide the staff for us. They're on site. They have their office on 712 Kansas, 3rd floor, and they work directly with our officers. And what we have is a recovery coach that we've had for 6 months, and it's worked very, very, very well. But we also have now a care coordinator, and I want to explain. And they both work 2nd and 3rd districts. But a recovery coach, and we've had that person now for about 4 to 5 months, is a recovering drug addict or alcoholic who accesses services in the community for our clients that have those problems, that have either, when we've done their risk needs assessment inventory and interviewed them, that's come up, or their charges have involved drugs and alcohol. Obviously, we know that that's a problem right there. It's someone to meet with them personally, to see and track and hold them to accountability for attending programs that they need, outpatient primarily, but to work with our treatment providers in the community, to work with AA and NA, and the scenario in the past, it's going to be the same thing with the care coordinator. The scenario in the past is client comes in, has their office appointment with us, and the officer says, well, are you involved in any kind of outpatient drug and alcohol treatment? Well, I know I should be, but I'm not. Are you going to AA and NA? Well, I know I should be, but I'm not. Okay, well, all right, so one of our goals in between our meeting here and our next meeting when you come back is that you've made contact, that you've applied for an assessment, we're gonna, that you've attended a meeting and you're looking into getting a sponsor. Okay, well, and then they leave our office with the hope that that happens. Well, with a recovery coach, we say, well, pick up our phone. Tom, would you come down the hall and meet with my client? Turn them over to Tom, who is our recovery coach, and he takes it from there. The accountability absolutely then is there. The follow-up is there. And then Tom, of course, keeps our officers abreast of how that process is going. And they have a great way of holding people accountable. There's a lot of excuses, in that, in with addictions and so forth. A lot of reasons why they don't make meetings, why they have a dirty UA, or, well, recovery coach cuts through that unlike any officer can, just absolutely, and helps to hold them accountable. Doesn't do any transport of people, but meets them in the community, meets them at AA groups, meets them at treatment providers, just as their person to see that that happens and continues to happen. Same thing on the mental health side then with the care coordinator. Now that's a person, rather than a recovering addict, is somebody that has social work degree, job skills, various things and qualifications. They will be housed in our offices as well. But they have the whole gamut of community-based services that at their disposal to help our people. So our officers just aren't trying to chase people down, making appointments for them, and then not having them show up, and then try. We have too many people to supervise to do that kind of work. Needs to be done. The clients need to be accountable, need to be getting those kind of treatments. It's so very hard for them at times to do that. And some of their mental health issues are preventative. I mean, that's an obstacle just to get them to focus, to show up on time for a meeting when they need to be there. So our care coordinator, we're just excited about having them. And then additional funding, about $20,000 for medications. That's huge, and that includes physician prescriptions as well as psychotropic prescriptions. Anything that they cannot afford to obtain right now, that for their health and well-being and for them to fully function in the community, we have money for that. Now, they can't obtain that themselves. They have to actually be accompanied by our officer, but we have now had a contracted relationship with the Vallejo Pharmacy, which is Genoa Health Services, and if our officer shows up with a client and the need and the prescription, then that will be filled. With the caveat, we're able to provide these medications for you this month, and maybe next month too. But one of the things we're going to work on is how can you continue to access the medications that are so important for you to be taking in order to be out in our community and to be functioning properly in a law-abiding way. How are we going to see that you can do that? So that when you're off of our supervision, you're still able to access the medications you need. This whole addition, this whole caveat is brand new to us. I think it's going to be happening, I would say, in the future on the juvenile side as well. But it's begun on the adult side first. And, I mean, there's nothing better, instead of sending somebody out with a name and a phone number, to call this person and set up an appointment and see if you can show up, to just say, I'm going to pick up the phone, so-and-so is going to come down, meet with you right now, going to take you into their office, they're going to get that process started before you leave the floor today, before you even get in the elevator. You're going to be all set up. That is huge for us. That's so exciting to have that additional funding and to have those kind of services available. So we're almost becoming kind of a one-stop shop. I mean, when you come from court, on the adult side at least, over to our offices, you're going to be in the process of getting everything you need in order to be law-abiding in the community and to see that you can be as successful as possible on your stay with intensive supervised probation. So it's been, for the first 12 months, really, it's been wonderful. We have gotten, these notices of extra funding, and when we've asked for them, we've gotten them, and we're getting things in place that we've never had before. And I'm just there. I'm just in the right spot right now to be a part of this. But I really see wonderful, wonderful things happening. And to think that, our adult population is about 800 people that live and work in Shawnee County and the nearby counties. And to think that 85% of those are doing okay, they're maintaining well. I think that's marvelous, marvelous. So I'm real pleased, real pleased. Any further questions?
Well, you know what, I'd like to thank you for your enthusiasm and your dedicated service.
Thank you.
And congratulate you on receiving additional funding. I wish we had your knack. Unfortunately, the legislature seems to
Yeah, I
be
was gonna
bent
say.
on taking money from the
I
counties.
know.
And making our
I'm
job
so
harder
sorry.
and harder. But I
It
would
is.
like to congratulate that. And congratulate you on the results.
I'll pass that along to my
Yeah,
staff.
and pass that along to your staff, but
Commissioner. Yeah.
I think the three of us like to see results. We love to see levels, trends, and comparisons. This is how we're doing, and this is how we know we're doing a good job because of quantitative data, and you've got it, and it's appreciated, so. Commissioner Buell?
Just along those thoughts of increased funding, and hopefully this is sustainable. I mean,
I believe it is.
And that at some point, then they don't come to the county and then rely on us to fund these types of initiatives. So I guess we'll just have to pay close attention and yeah. But it's good that the dollars are going where they're making
It
probably
is.
the most difference
It
right
is,
now.
yeah.
So that's good.
Commissioner Cook?
You can
anything
have the
additional?
best, you can have the best program, but staff is what makes it work.
That's right.
And so your staff is really to be commended.
They are excellent.
Yeah.
They're just experienced, seasoned, have the community contacts, have the savvy. They're just very, very, very good at what they do. And training-wise and things that KDOC is providing for us just continues to get better. We're really in a pioneer era, correct? We're just inventing this as we go along in a lot of ways. It's not like blacksmithing or, ancient arts or something. This whole thing has just come about last 50, 60 years. Nobody's ever tried to do this kind of work before. So it's fun to see it evolve this way.
I guess on the flip side, though, I wish you didn't have 800,
Yeah.
to work with. I really wish
Oh,
we
yeah.
didn't have that many entering the system. I mean, I know it's wishful thinking,
Yeah.
but
Well,
really,
No, but
you know.
On the flip side,
Yeah.
those are 800 people that could be in a correctional institution.
Oh,
Would
yeah.
be.
Yeah, yeah.
And one of the things, the success, I think, is also attributable to, by the time they reach community corrections, this is the last stop before prison.
Mhm.
And so there are 15% that don't get that,
Yeah, true.
can't get that.
Yeah.
But you also have a great people that finally get that. Sometimes it takes, the community, keeping the community safe
but still making sure that justice is served.
Sure.
So,
Recidivism is still a challenge. What they do after they get off supervision, they're not always they don't always remain law-abiding for years and years. Some certainly do. We have some successes in that as well, but certainly while we're supervising them, it's working, I guess would be the way to do it, to say it. And I've looked at some restructuring things that I'll be sharing with you in the near future after 12 months on the job, and I think some ways that we can sustain some additional officers to our staff that would lower the ratios a little bit, and certainly be a huge morale booster. But we'll talk more about that in the near future.
Very good.
Okay.
Thank you again.
Thank
Ed.
you all.
We're going to take a short break, and at 11 o'clock, we will have budget hearing on service programs for the elderly. So